never taught. Empathy and patient communication is something that we're never taught. But at the same time, it's also something that's been always expected out of us as doctors. The kindness and empathy and, just basic patient communication.
The
But there's
I,
not
I
one
would,
class.
I would like to correct you at this moment that it is expected out of probably of every human being. We need to be kind in
Yes.
our interactions. And once you realize this, you realize it doesn't need to be taught. The problem today is that, I'm sure, you may see my point here or not. Problem today is I can't teach you how to be a good human being. Nobody can. You need to, feel it from inside. That is the difference is the problem. I'll give you the, the diagnosis of the problem, why it is happening. In America, when you do medical school, you are older than what you do in India. In America, you would do graduate into a particular any subject and then think about doing medicine. You're older in your age group. Okay. So once you become slightly old, you see some things in your own life, in your own family that makes you understand the sometimes how as a human being we are helpless. It's not easy for being a doctor. You don't become God. To put it in one line, you don't become God. There would be things that would happen even when you are a doctor. There would things which would happen even when you are a surgeon or a neurosurgeon or cardiac surgeon, Harvard trained, whatever things would happen, and that ground sometimes you lose, and then you stop being kind to other people because you are not able to see their perspective. So that is like, but can we, and even the National Medical Council is constantly working on it. They have introduced a subject called as ethics and communication. I'm sure you are the batch who must have attended those EdCom sessions or foundation years in the beginning. I don't know. They also
Yes,
started it.
sir.
But the problem is in the age group. A 16-year-old boy, when somebody is talking to you about ethics and all, maybe at that age you're not able to resonate at, you can't see that the other person is in pain, or there would be mortalities that you will be dealing with. As a doctor, what you're dealing with is immense. It is just because of the age gap that, in the West you are people who are becoming doctors slightly older and you see more world. So first of all, things will come to you. Things will come to you. You will evolve as a person with time. The only thing is, you can evolve into someone who is more arrogant or someone who's more kind. You need to, take that, irrespective of your profession. We need to learn that.
Yes, sir.
The second is the part which we need to learn is communication. Now in the modern world, what will happen is, in the modern world, what will your every action that you will do as a doctor, as a senior, as a junior, would be under a scanner. Like for example, suppose you are a senior doctor. Sometimes a junior doctor might say that you were unfair to me, or suppose you're a junior doctor, or your senior doctor might say he is incompetent. This is between doctor to doctor. A patient might say that he did not advise me this, or you have a lot of paramedics around, nursing staff, so many people around you. You are a team, part of a team. Anyone can say that you were not up to the mark. So all your communications, you gradually need to develop a habit of documenting. You will, and this is what has to be learned, that a lot of times especially in a country like India, where communications take the back seat. So first is communication between the team itself, then communication with the patient clearly, well documented, has to be the norm in future, because what we are seeing in India is a lot of mistrust. Mistrust between all stakeholders of healthcare. Patients don't trust doctors any longer. Doctors don't trust patients any longer. Doctors don't trust the other staff in the juniors. Don't trust the seniors. Seniors don't trust the juniors. We are looking at massive mistrust all around. The only way to survive and create trust is by documenting what you are saying all the time. You may be right or wrong, but it has to be documented. That many times in India I see a doctor who has written on a OPD sheet. I'm sure you might have seen in your family as well. He has written nothing on it, just the drugs, and signed. Not even the diagnosis is written on the OPD sheet. So this idea of opacity has to go. We no longer can survive in a opaque healthcare where the doctor is the king. He doesn't need to tell anybody anything. It is not going to work. So communication is critical to learn. People have to talk more about it. But empathy and kindness probably as persons, if we are opting for this profession, I feel the default people who should come into medicine should have that kindness. I don't know if they can test it in the exam in pre-medical test as well.